thank you for the opportunity to visit with you today about local boards of health in Iowa. I hope that most of you have had the opportunity to attend a county board of health meeting, either for your work in prevention or just because you're an interested member of your own community. The meetings are open to the public. Anyone can attend, and I encourage you to take the time to learn more about your own local board of health. While each county board of health is, in fact, a formal board, today I want you to take a look at those boards from a different lens. That lens is going to help you view each board from their perspective, not just your own. You may want to envision each board like our own families. The experiences that each individual contributes to the uniqueness of each unit as a whole. Some days, everything runs like clockwork. Other days, like today with our technological issues, things might be a little bit different than that. We might just end up with some different viewpoints that will lead to some lively conversation. The craziness of daily life might lead to feelings of being rushed, or worse yet, sometimes we might feel unheard or unappreciated at those meetings. Each one of those boards has their own personality, and the more that you guys get to know them, the more you'll be able to appreciate their roles as volunteers in their communities. So let's take a closer look. And thank you, Claire Grace, for that introduction. That was very nice. All right, so our 5 objectives for today are to define the purpose of a county board of health, explain the difference between the Board of Health and the local public health agency, understand why agencies funded by the Iowa Department of Public Health must link back to the county boards of health, and then explore some ways that boards of health may be able to enhance your work. And then the funnest, last but not least, learn some tips for making presentations to the local board of health. Along the way, I will let you know when we've met those 5 objectives. I know that you're all probably looking forward to your weekend, so that might mean that it's hard for you to stay focused on your computer. I'm going to do my best to keep you engaged and at the same time provide some useful information for your work. In my lame attempt to keep you engaged, I want to let you know that along the way, you will be hearing me talk to my own self. So while that probably doesn't make sense to you right now, hopefully it will as we move along. So I see that Claire Grace has that slide up there now. So first, who am I and why am I the one that's speaking with you today? As Claire Grace said, my name is Heather Bombi, and I serve Region 1 in central Iowa, the yellow part there. Our bureau, the Bureau of Public Health Performance, is within the Deputy Director's Office at the Iowa Department of Public Health. 6 consultants cover all 99 counties, and we're assigned as indicated on the map. The consultants are here to serve as the liaison between our local public health agencies, our local board of health, and of course, the Iowa Department of Public Health. We offer orientation and guidance to Board of Health members. We also provide orientation and training to key personnel at our local public health agencies. We administer the local public health services contract, which is funding of state tax dollars that all 99 local boards of health receive. We serve as a resource to local public health administrators and local board of health members. When my family asks me what I do, my quick answer is that I pretty much do whatever my agencies or my local boards of health need me to do. And I still don't know if they understand, but that's what I try to say. I do attend Board of Health meetings in all of my counties at a minimum of once or twice every year, but if needed, for some reason, like they might have an organizational change or we may have had a retirement and a new staff person has started, So if there's some significant changes within a particular county, I usually attend all of their meetings. So on the average, I attend about 40 Board of Health meetings every year. And you can go ahead and go then to the next slide. Thank you. So that's a lot of Board of Health meetings, and I kind of would like to get a sense of how you guys all feel about board meetings. And of course, you can spell that either B-O-A-R-D or B-O-R-E-D, whatever suits your fancy or how you're feeling. So Claire Grace is going to be putting up a poll that kind of best describes your attitude towards board meetings. Are you a cat? Are you the baby Yoda in the middle, or are you the dog? Maybe you're none of these. Maybe you love attending meetings. So our cat there, she's just like sarcastically, another boring meeting. Great. And then the Yoda in the middle, boring meeting. Sneak out, you must. And of course, if you ever get bored during those Board of Health meetings, just go ahead and draw eyebrows on your dog. So it's actually a pretty even split, but it looks like so far the majority is saying, are you kidding? I love attending at 32%. The cat, 21%, the dog, 16%, baby Yoda is 16%, none of the above is 21%. Interesting results. So they always say that people are either dog people or they're cat people. And I really don't have any idea about Star Wars types of things, but I've seen a lot of memes with a baby Yoda, so I thought I would try to be hip and include that. But honestly, I don't even know if this is baby Yoda or another kind of Yoda. But for those of you that have some intimate Star Wars knowledge, go ahead and chat that to Claire Grace and she can let us know. But rest assured, that most of us wouldn't put attending meetings at the top of our top 10 things I love to do list. Maybe it wouldn't even make your top 20, but we all have meetings that we must attend, and oftentimes we have to provide a presentation at those meetings. Whether you love board meetings or you'd rather be getting a root canal, I hope I can provide you with enough tools that make your faces look like the engaged doggy rather than the sarcastic kitty or the I want to sneak out of here Yoda. Okay, so we had a bit of fun with our memes, but now we have to get down to work. So first of all, you probably want to know, how do these boards come to be exactly? Well, your County Board of Supervisors appoints members to serve on local Board of Health. The members are appointed for a 3-year term, or sometimes the members are appointed to fulfill a term that has been left vacant. Boards of Health are primarily autonomous from the Board of Supervisors. The supervisors really just have authority over those local boards of health in 3 areas: appointment, approval of regulations that have been adopted by the Board of Health, and of course the authority of the appropriation of county tax dollars that are used for public health services. It's important to keep in mind that while county supervisors in Iowa are elected officials, the Board of Health members are appointed and they are serving as unpaid volunteers. It's important for you guys to remember that as you're presenting to them. They're unpaid volunteers. So depending on the time of their meetings, many Board of Health members may be attending these meetings, before they go to their regular jobs during the day. If it's a 7 a.m. meeting, they might be spending their lunch hour at the meetings, or honestly, they might be dragging into a Board of Health meeting at the end of a very long work day. So many of our Board of Health members serve on several other boards or committees or councils, and they're most likely well connected to many other organizations within their communities. So just like our families, depending on how their days have gone, or what they have on their agendas for the day, the moods throughout the room may vary. Like I said, each board has its own personality. Okay, and the next slide. So we need to talk about the purpose and jurisdiction of those boards of health. So officially, the law, which is Iowa Code Chapter 137 specifically, gives local boards of health jurisdiction over public health matters within their county. So that could range from personal care home visits to population-based services that really affect the larger population as a whole, all the way to environmental health issues. So if you have already presented at a Board of Health meeting and you stayed for their entire meeting, you probably learned more about septic systems from the environmental health specialist than you ever imagined you would. Boards of health cover many, many topics over the course of their meetings. They may be working on a septic variance request. They may be developing a position statement on water fluoridation. They may be getting reports on dog bites. They might be considering applications for hiring a new public health director, or they could be hearing about even the number of nursing and home care aid visits that the agency is providing. So from septic systems to home care patients with sepsis and everything in between, boards of health cover a lot of ground during their meetings. In summary, boards of health will have many topics to cover during their time together, and just keep in mind that the presentation that you provide could just be a blip on their radar. So you need to make your time count and make it memorable for them. And the next slide. Okay, so very exciting little topics here about code and administrative code, but the Iowa Code and Iowa Administrative Code rules actually provide the legal authority to local boards of health. Chapter 137 is the law, and Chapter 77 are the details or the rules that accompany that law. So get ready, here's the exciting code language, but according to Chapter 137, local boards of health shall enforce state health laws and the rules, make and enforce rules and regulations as may be necessary for the protection and improvement of the public health, employ persons as necessary for the efficient discharge of its duties, provide member names, officers, and official minutes of local board of health meetings and reports of the local board of health operations and activities to the state health department. Kind of a mouthful. And then it goes on to say that a local board of health may provide such population-based and personal health services and environmental health services as may be deemed necessary for the promotion and protection and improvement of the health of the public. All right, so tried to get through all that code stuff as quickly as I could so that you weren't falling asleep on a Friday afternoon, but here's where I start talking to myself. So note to self, you've just learned objective number 1, which was defining the purpose and jurisdiction of the local board of health. Great job, self. All right, and the next slide. Okay, now that you know the purpose and jurisdiction of local boards of health, let's discuss how those boards of health are different from the local public health agencies. This matters because you will most likely be going through the agency to get on the agenda of the Board of Health. So while local boards of health are individualized, they all have some similarities pertaining to standardized requirements. And so those are on the left there. So they need to have at least 5 members. Some have more than that, but they must have at least 5, and one of those has to be a licensed physician. They have to meet a minimum of 6 times a year. Some counties do meet every month, and they have special meetings as needed. They must report their membership and their officers to the department, and they also submit their meeting minutes to us. They have to follow public meeting laws, and really their job is to individualize the public health services to meet the needs of their county. On the right-hand side, about those local public health agencies, they're actually there to work on behalf of the Board of Health. So they might be directly governed by the Board of Health, or they may be contracted by the Board of Health to provide public health services. And really it's their staff that's providing public health services on behalf of the Board of Health. And they are the day-to-day, they provide the day-to-day public health functions within their county. The easiest way, I think, to keep them separate is just to keep in mind that the local Board of Health is really the governance side of public health, and then that local public health agency is the staff side. And next slide. Those of you, I don't know if anybody from the department is on the call, but when you work with the department, we love maps there. It's just, we have a map for everything. So to kind of make things even more complicated, we have some boards of health that contract with a hospital, or you could say a health system, to provide public health services on their behalf. So the map that we have here identifies our 34 counties in which the local boards of health contract with another organization to serve as the local public health agency within the county. And next slide. A favorite saying that we have in Iowa public health circles is that if you've seen one county public health, you've seen one county public health. That really has pros and cons, but the bottom line is that the local Board of Health gets to determine what public health looks like within their own county. Because we are a decentralized state, each county Board of Health gets to decide what's going to work best for them. So they may directly govern the local public health agency, meaning that the public health department is a department within the county government structure. But in other counties where boards of health contract with local health systems to provide public health services, that might be with a hospital. So an increasing level of confusion is that some counties have both of those methods, and there are several local public health agencies there. All right, so you just learned our next objective there. So note to self, you've just learned the difference between the local Board of Health and the local public health agency, and how each county is structured differently in Iowa. Great job, you're on a roll. All right, why do you even have to go to Board of Health meetings? Well, you may have signed up for this webinar today because you truly wanted to learn more about local boards of health, or maybe your supervisor told you that you had to. But either way, I'm glad that you're here, and it's important to understand that there is a requirement that agencies receiving funding from the Iowa Department of Public Health must connect or link with local boards of health. The department has hundreds and hundreds of contracts. The actual contractor could be the local Board of Health in some, but with many other funding opportunities or the contracts at the Iowa Department of Public Health, organizations such as yours may be identified as the contractor. Because of that, those organizations are required to follow the language within the contract. So some examples of prevention grants that require collaboration with local boards of health are the Youth Substance Abuse Prevention Services, Strategic Prevention Framework for Prescription Drugs Project, and the Integrated Provider Network Grant. So those contracts have that very official contract language, and I will quote directly from that. So as a condition of the contractor shall assure linkage with the local board of health in each county where the services are provided. The contractor will assure that the local board of health has been actively engaged in planning for and evaluation of services. We'll also maintain effective linkages with the local board of health, including timely and effective communication and ongoing collaboration. Yes, I did actually just read that slide to you, but it is important. So in our upcoming slides, we'll discuss some ways to make this linkage as beneficial and I hope pain-free as possible for both you and the local board of health. If you haven't seen the actual contracts that have this very official contract language in it, be sure to ask your supervisor to show you and kind of explain how you fit into those contract expectations. So another note to self, you now know that agencies that receive funding from the Iowa Department of Public Health must connect with local boards of health because of the contracts, because of the language within the contracts. All right, next slide. Our good old Tom Cruise slide. All right, so even though Jerry Maguire was released all the way back in 1996, it's a classic line that still rings true today. Help me help you. Even though Jerry was really referencing making money, there's many ways that local boards of health can help support the work that you do. So first, recall that we talked about every board of health must have a physician. So those physicians are always wanting to know what services or programs are available in their communities so that they can help serve, so that they know resources that are there to help serve their patients. And second, as we talked about before, many of those Board of Health members are well connected within their communities. The more that they know how your programs help people, the more they will be able to share that information with others, with their patients or with their colleagues. Third, you may need letters of support for certain grant opportunities. The more that those Board of Health members are familiar with the work that you do, the more likely they'll be able to support the future endeavors that your agency is pursuing. And finally, even though we haven't talked about it yet, one of the requirements of a local Board of Health is that they must assure that a community health needs assessment is completed every 5 years. I think that for those of you that regularly attend these monthly webinars, I think I heard somebody say that in the past, John Durbin with the Iowa Department of Public Health has provided a training on community health needs assessments and health improvement plans in Iowa. Those assessments are often the cornerstone for eligibility of applying for funding on a national level. If you participate in that community health needs assessment process with the Board of Health, you're going to have a voice in identifying the needs within your communities. So the more that those Board of Health members know you and your agency, the more likely there's going to be for them to reach out to you when they need your subject matter expertise. Okay, so I feel like we're moving really quickly through those first 4 objectives, but note to self, I now understand how important it is to build my relationship with local Board of Health members so that they can help support my work. All right, next slide. Okay. What to expect in a meeting. Our final objective for the day is for you to learn some tips for presenting at local Board of Health meetings. This is kind of the gist of our topic today. Some people really haven't had any experiences serving on a public board, so here are some of the basics about a public meeting and what you can expect when you attend a Board of Health meeting. So the members will be there, and they need to have a quorum, which is the majority of their members present, or a quorum is a majority of their members there to take any action. And then some of those members might be like my family. They might have an opinion on most things, and they might be convinced that their way of thinking is the best way. Other members there may be newer to their role and might still be trying to figure things out. And then the other members are probably going to be somewhere in between. And again, it's going to depend on what they've had going on in their own personal lives that day. That Board of Health chair is a person that's going to be presiding over the meeting, and that person's going to keep things moving. So the staff that might be there, that's typically the director of the local public health agency. That person's going to provide a majority of the information during the meeting, but other staff of the agency might be present to provide specific program information or might be there to keep minutes on behalf of the Board of Health. There may be other partners or presenters there, and so this is you within that meeting. But please note, make sure to get on the agenda. I've seen it where sometimes folks just might show up and ask to present during the public forum time, and I guess that's is allowable, but it really is not ideal. And we'll talk a little bit more about getting on the agenda in a little bit. So members of the public may attend. They may provide some input during the public forum time, or they just might kind of sit in the gallery and observe because they're interested about a topic that happens to be on the agenda. In some Board of Health meetings, the press or the media might be there. We really never know what might interest the press during a meeting, so just be aware that any information that you present, you could potentially be quoted from the presentation that you provide. So Robert's Rules of Order and open meeting laws. Boards of Health do their best to follow Robert's Rules of Order, which is basically a simplified version of parliamentary procedure. They're only going to take action on items that are on the agenda, and they're going to be making motions and seconding those motions and voting on items that need action. Because they are a governmental board, they have to follow the open meeting laws of Iowa. So think of it like the Board of Health has to follow the same open meeting laws as school boards and city councils and the county boards of supervisors. It's those sunshine advisories or sunshine laws that we have in Iowa. Those open meeting laws include posting the agenda at least 24 hours in advance. The minutes will reflect what occurred during the meeting, and then their official minutes are going to be voted on during their next meeting. So now that you know what that meeting is going to look like, we're going to discuss some helpful hints to make it a positive experience for both you and the Board of Health. And our next slide has some helpful hints. All right, to get on the agenda, you must get in contact with the elusive keeper of the agenda. That really varies for each county. It might be the local public health agency director. It may be somebody at the courthouse. It might be the environmental health specialist, or I have one county where it's actually the Board of Health chair that puts that agenda together himself. So I suggest getting in touch with the local public health agency director first, and then they're going to direct you to the appropriate person, if it's not them. If that isn't working or hasn't worked for you in the past, please feel free. You can contact me or any of the other consultants, and we'd be more than happy to help you get on that agenda. All right. Fiscal years run July through June. Don't wait until the last minute to try and get your presentation in so that you're meeting your contract requirement. Everybody knows that old saying, a lack of preparation on your part does not constitute an emergency on my part. So that means if you waited until the last minute to try and get on their agenda, you may end up being disappointed because it might already be a full agenda and they won't have time for you that particular month. So your best bet is to reach out at the beginning of the fiscal year and schedule your presentation way in advance. Keep that contact information that you've gained of the keeper of the agenda so that you can touch base prior to your presenting and make sure everything's still a go. Life happens and sometimes their meetings do get rescheduled. And I've had it happen to me before where I plan on going to the Board of Health meeting and they've canceled it because they didn't have a quorum and I didn't double check and I get there and nobody's there. So just double check so you're not making a wasted trip. Okay, be sure to introduce yourself. Some counties are recording the meeting, so it's important that you're getting on record. Remember that the agenda that they have may or may not have your name listed with your agency, so be sure to give your name as well as your title and position along with the agency. So I can't stress this enough. Make sure that you're asking ahead of time how much time they're going to allow you for your presentation. Depending on the county, they might give you 5 minutes or they may allow you up to 15 minutes. Typically, you're going to start losing them if you talk too long. I hope that's not the case today, but you will. That's just the reality of it. But just keep in mind, like we talked about before, they do have a lot of other business to conduct during their meeting, and your presentation is just one slice of the pie that they're going to be eating that day. If a read-ahead report is sent at least a week prior to a meeting, that agenda keeper person will be able to send out your report to the Board of Health members within their meeting packet. That way, when you're presenting, you can just cover the highlights during the meeting because hopefully the Board of Health members will have reviewed your report ahead of time. Keep the report and your presentation relevant and specific. If your contract or agency serves multiple counties, please be specific about the county that you're presenting to and provide their numbers. They don't want to know about 10 counties aggregate data. They want to know about their own specific county. So basically they want to know, how are you serving the people living in their county? How many people you're serving? If applicable, how much of the grant is being utilized in their county? Bottom line, how are the services that your agency is providing? How is that making an impact? A few statistics are enough. Kind of ask yourself what you would want to read. Do you want to read a one-page succinct informational report with some infographics that are fun and easy to read? Or do you want to try to sift through a 5-page data-heavy, small print, no white space report? So keep those things in mind. They're just like you, just like your families. They want things that are user-friendly. So be professional. Try not to start your presentation by saying, I'm here because it's a contract requirement. makes you sound like you'd rather be anywhere else in the world than right there with them. So just, try to be personable and smile, make eye contact, and they're all very nice folks. Be sure to ask them if they have any questions. And if they ask something that's really hard, just be honest with them and tell them you're going to have to get back to them with what that answer is. They'll appreciate that. So suffice it to say that most of the local Board of Health members you're presenting to do not live in your professional world. So avoid using acronyms or slang because they won't know what you're talking about. If you do have to use that, make sure that you're explaining it so that they understand. So hopefully we have a very short video clip that Claire Grace is going to put up for us.
You going to the party tonight?
Nah, I can't make it.
That's bogus.
Yeah, FOMO.
You have an ostrich?
What?
FOMO, fell off my ostrich.
Dude, FOMO means fear of missing out.
Oh.
Don't know your slang? Visit slangit.com.
Okay. That was pretty cute. And TBH, does everybody know what that means? If you do, you can chat your guesses to Claire Grace. So TBH, I didn't know what FOMO meant until I was putting this presentation together. And yes, if that shows my age, that's fine. But TBH, or to be honest, I was thinking it probably meant something way worse than fear of missing out. But I just wanted to provide you with some food for thought about how we present information that is very familiar to us, but can be very unfamiliar to others. So I think it's legit that the fear or falling off my ostrich could certainly be FOMO. So we've all done that and used acronyms and slang, and I'm sure I've probably done it today as well. But, check yourself, put yourself in their shoes. You can always kind of think to yourself, if your grandma wouldn't know what acronym you're using, feel confident that those Board of Health members are not going to know either. So we're going to try to do some quick polls today with some acronyms. And Claire Grace is going to pull up some polls here about what is a China. Very good, very good. Looks like most of you understand that it is stands for Community Health Needs Assessment, but actually it does also stand for, according to the interweb anyway, Long-CAR China Biopharma ETF is a thing. That is the China, CHNA is the stock name for that company. And then, yes, it also stands for Child in Need of Assistance in some circles. So just kind of a way we were trying to point out that those acronyms can mean different things to different people. So keep that in mind when you're providing your presentation. So the next one that we have is the acronym of DOA. So is it Dead on Arrival, Dogs on Apps, Department on Aging, defects on arrival, driving over apples, or none of the above? Okay, good. And Claire Grace, I guess I don't know if our participants can see the results or not as they're doing those. If you could.
They can't see it as we're doing it. They can see it at the end when I share it back with everybody.
Okay, terrific, terrific. So DOA for this one, yes, it could be dead on arrival. It might be dogs on apps. I don't know. No, I don't think that it is. But yes, it is Department on Aging in Iowa. That is what it is called. And then again, according to the internet, it is defect on arrival. I think in like the Amazon world, that's significant in their world. So another example of what DOA might stand for. So keep that in mind as you're giving your presentations. And yes, most of you picked dead on arrival, it looks like. And the last one, so what does SOS stand for? Gosh, immediately 100% of you said save our ship. Some of you think it's save our soul. Nobody thinks it's save on socks. Some of you are thinking none of them. All right, so I think I had learned this way back in the day, but really SOS doesn't stand for anything. It was chosen as a sign of distress for its unmistakable Morse code representation, 3 dots, 3 dashes, 3 dots. So acronyms might mean different things to different people, depending on the everyday world that they're functioning in. So just try and remember that using acronyms or slang may cause the Board of Health members to STH, shake their heads, and try not to make them LOL, of course, laugh out loud, at trying to decipher what you're meaning. All right, so final note to self. Self, you've learned some good tips today for your presentations at Board of Health meetings, and you've made your way through all the objectives that we set forth at the beginning of the webinar. Congratulations. And the next slide, you're not quite done yet. Don't sign out, anybody. We've got a little more business to do. So thanks for taking the time to listen to me about my families or my counties throughout the states. Each local Board of Health is responsible for safeguarding the health of their particular community. They pursue that goal through the 3 core public health functions of assessment, policy development, and assurance. So assessment, in a nutshell, is just identifying the county's public health needs and determining the community's public health priorities. The second core function, policy development, means that local boards of health are going to stay informed of important public health issues, like, of course, right now, coronavirus is a hot topic, but of course, get your flu shot and wash your hands and stay home if you're sick. So they're going to stay informed of those important public health issues, and they're going to be responsible for taking the lead in public health policy development. And the third core function is assurance. And the local boards of health are going to work to assure the health of their community by encouraging action by others and by requiring action through regulation or by directly providing those services. So work to build your relationship with those local boards of health. Because they do have jurisdiction over public health matters within their county, it's important for them and you to build and maintain relationships with key policymakers other community partners like yourself, and the general public in determining what public health services are needed and what's offered within their communities. So just like our families, they're going to keep evolving and working toward making things better for the next generation. That's their job. So we're going to wrap up by having you guys share with us how your view of local boards of health may have changed since listening to this webinar, and share any next steps that you might be considering for fostering that relationship. And so if you want
Heather.
to put those...
And just just for folks, in terms of thinking about timing, I think when sometimes it's like sort of a flag for folks to say like, well, we're going to wrap up, but we still have lots of time. Heather really wanted to structure this so that there was some content at this front end, but lots of time still for questions and discussion. So don't want anybody to feel like, you know, you're asking a question is sort of keeping the webinar from ending, because that happens sometimes. So lots of time left still. And Heather, we actually have a question already that Leanne is wondering, she said it's really interesting in the chat. It was really interesting to learn that some counties have local boards of health and others don't. I think maybe that was in how you sort of talked about how things were structured in some counties and in others. And she said she may have missed it, but she's wondering about any recommendations on doing equitable work in counties that don't, or is there any difference in sort of how you work with counties that have different structures? I'm tacking on to the end of that.
Okay, so I probably need to clarify how I explained that all counties have a local board of health, but where the structure is different is where that local board of health might govern their own local public health agency, they're a county department, or that local board of health may choose to contract with a hospital or a visiting nurse service or something like that to provide public health services on their behalf. So every county does have a local board of health. Did I answer the whole question?
Yes. Yeah. Thank you. And then someone just shared, just kind of made a comment that she wasn't aware of the presenting requirements. And then it was interesting to learn about that, exactly what you just talked about, sort of that contractor local board of health relationship, and that she's going to follow up to determine what the relationships are. I don't know if you would, maybe even someone else on the call, or if you want to speak to, I know I can speak a little bit from my own experience of having done direct service, doing this with contracts in Iowa, of when some opportunities are to do that. I would often do it at a couple of different points. So one was typically right at the beginning of a new funding opportunity. So, you know, when like a new grant year is starting, I would sometimes use it as an opportunity to meet with someone from the local board of health, and from local public health, which, as we've talked about, are you know, distinct, even though there's a relationship between them, just to sit down and say, hey, here's who I am, here's what our funding is, here's the things we're trying to do with our funding, and to have some of that before conversation, not necessarily that happens at a meeting, in terms of saying, you know, what would be helpful. I can bring, you know, data, I can tell you about the strategies we're working on, you know, here are the things that I might like to get some input and information on, and that at the start of a funding opportunity is a nice time to do that. Also before China HIP starts, you know, like when that, and Heather, I don't know, maybe you can talk a little bit about the cycle of that and when that often happens, is also a good opportunity to start early ahead of that, to talk about how you might be able to help, you know, share some information that might inform that, and to, you know, when is a good time to be involved. And Heather, do you want to add anything? And then we could up also. I know we've got some folks on the call that have been doing this a long time as well.
You make some excellent points in what you said. You know, if your schedules allow when you're there for that Board of Health meeting, you know, if you can get there a couple minutes ahead of time to work on that relationship building, and if you can stay, for the whole meeting and then maybe stay afterwards for a couple minutes, you may be able to provide them with some additional information that you weren't able to get across, during that short time. So I know they really appreciate having those presentations that are engaging and, interesting to them. It's much more interesting hearing about prevention work and services that are provided in the community and, the risks involved with vaping and all those things. It's a lot more fun to hear those presentations than to sit there and talk about personnel issues and budget and policy, the mundane things that they have to do with their work. So yeah, build those relationships. And then relating back to the China HIP timeline. So it's kind of peculiar in Iowa. So we say that, or the law says that boards of health have to assure that those community health needs assessments are completed every 5 years. And many counties are working on them right now because the report to the department is due a year from now in February of 21. Having said that, hospitals, nonprofit hospitals actually also have an IRS requirement that they have to complete a community health needs assessment every 3 years. So some counties, especially those that are county-based public health agencies, tag along with the hospitals, and it's great that they do their assessment together. So sometimes then they are on a different cycle than what other counties are. So I can't just give a blanket statement as to where everybody's at. But again, if you reached out to your county public health director, they would be able to tell you for sure for your particular county.
And a couple people have talked about not realizing it was a requirement to present or kind of weighing in on how often that they present. So I definitely would check, ask people to check back with their agency as far as what your contract language is, and then also what you've written into your action plan. And so often this, what we're showing on the screen here is this, like Heather said, kind of this official contract language. But because this is a condition to provide that linkage, then often agencies will write into your actual action plan that you're working on for the year that you'll present monthly, you'll present quarterly, or whatever it might be. And so that might look different agency to agency, and it's a conversation you would want to have with your agency, with your supervisor. Also, another thing I think that can be helpful is if you work at a larger agency, you might find that there are a couple of different groupings of staff that work under different contracts that may also have a similar requirement or have a reason to be presenting. So for example, IPN might have this requirement, and also those doing tobacco prevention. And so it makes, in an agency that I worked for previously where we had multiple grants that had this requirement between mentoring funding and tobacco funding and some different prevention funding, we would make sure that this was part of our planning as a staff to get together for who our lead point person was going to be with each county board of health that we interacted with. And then that person was responsible for, making sure that they had the highlights and the updates from each of those other staff persons. And then they would bring that, they would send it ahead. And they would bring that to the meeting because Joy mentioned, and I think it was Joy that mentioned in her comment, she has a relationship with her board of health that she only goes to talk to them. I think she said quarterly. I'm trying to go back to it. Quarterly, and then they know also when she brings something that it's something that she really wants to make sure is worth their time. And similarly, I think it's showing them good use of their time that there aren't multiple people from your same agency contacting them with similar requests. Let's see. What else? We've got lots of comments coming in. And while I'm still scrolling through the comments here, does anybody else, I know we've got a few people at least on the call that have been doing this for a while. Do you have any tips or things that you've done, or things that pitfalls that you would suggest be avoided? So Jean is saying that their Board of Health requests that agencies only present once per year. So Heather, do you have a suggestion if, you're, working in prevention and local boards of health are an important partner, and also that you have this condition as part of your contract to provide this regular linkage, and that you're actively engaged in, helping to plan and sharing information and all of those things. If your local Board of Health only wants you to come present once per year, do you have any suggestions there?
Yeah, so because they are open meetings, like I was talking about, so anybody can attend them. You don't have to be on their agenda to give a presentation. You can just come as a member of the public and sit in the gallery or along the wall, however they're set up, and just be there. Make sure that you wear your name tag so that they remember, oh yeah, she was here from ABC agency and gave that presentation before. I have a question for her. And so then they might ask you afterwards. And so you're working on building that relationship. So yeah, they are open meetings that you are always welcome to attend.
And Kathy said she likes the idea of sending information ahead of time, and that they had a huge success recently when a Board of Health that had often been difficult to get on their agenda called them to talk about their work during National Mentoring Month. So that's pretty exciting, Kathy. Kathy, do you feel like there was anything particular that led them to reach out to you around that? Was it something that they saw in the community, or was it your quiet persistence?
I unmuted myself. Can you hear me?
We can, yeah.
Okay. I think whatever's been said about building the relationship is absolutely huge. That staying after a meeting, that I always get there early when I come to that Board of Health meeting, because there's always somebody in the room talking about the weather or whatever, and you start building some of those relationships. It's just huge to have that, because and then too, knowing the person that was the staff person, I knew her through 3 different areas in my life. That also helped, from the sense that she was like, oh yeah, we talked about that somewhere when I was doing something, and you mentioned we'd like you could come and talk during January, and she remembered that and called us. And so just being that persistent presence, but as you said too, that professionalism is always there, because I've been in situations where people try to kind of bully their way into Board of Health meetings, and people see that and go, ick. So you have to be professional and be patient too, because it will happen, hopefully.
Thanks, Kathy. That was great. So helpful.
Yeah,
Yep.
it was. Yeah, it really is, building those relationships and having them get to know you. I promise you, they are probably not going to remember all the statistics that you gave them during your report. But if they if they feel like they know you and they can trust you, with the information that you're giving them, if something pops up sometime, that someone asked them about, they may not have the answer, but they're going to be like, oh, I remember Kathy coming to my meeting. Let's ask her to come back to talk about this new hot topic or new program or whatever it is. So yeah, building those relationships is the biggest thing that you can do.
And you and I had talked earlier, Heather, about this question about whether there's a best time of the year to get on the agenda or a better time to make some of that connection. I mean, we want this to be ongoing, but is there a time that maybe someone's more open to you making some time for a presentation? Any suggestions on that?
Yeah, I would say, if you can at the beginning of that fiscal year, in July, to reach out to that agenda keeper and really just tell them, that you would like to get on the agenda and ask them, what's their best time to get that scheduled. That way it's nice for you so that you can get it, in your planner, and it's nice for them because then they can plan around the requirements that you have to present to them. I'll tell you that typically late November and December and into January are really sometimes tougher times because that's their budget time. So they might be spending a lot of their meeting time focusing on budget stuff, which is never fun. And if they're in a not great mood anyway because they're talking about budget stuff, you probably don't want to be there to present to them. And I'm generalizing, that's not the case in all the counties, but that might be a time that you want to avoid. Plus it gets just gets difficult during that holiday season that people are taking time off and they may or may not have a quorum there. So
those might be the months that you go a little early, you chat about the weather, everybody's in a good mood to talk about the holidays, and then be a little more persistent with trying to get on the agenda, a couple months after that time has passed, sounds like.
Yep. And when I talked about the just presenting during that public forum time, if you think of yourself as a Board of Health member and you get your agenda and you're like, oh, it's probably going to be a short meeting because we don't have much on the agenda. So maybe you schedule something for, you're just planning on an hour meeting, but so you plan something afterwards. But then if someone, comes to gives a presentation during that public forum time, instead of actually having it on the agenda, they may or may not receive that the greatest because they weren't planning on it. So, and I know it happens sometimes, it just does. But if you can, earlier in that fiscal year, just reach out and ask them what's the best time.
I wonder too, Kathy's example of having asked to come and talk around National Mentoring Month, if that's something to also maybe think of, is if you've got something really compelling to say a couple months in advance, hey, in a couple months, it's going to be Alcohol Awareness Month. I thought that might be a great, I come to your meetings regularly. I want to know what's going on, but maybe that's a great month for me to actually get on the agenda and bring a little bit of information. Or if you can connect it to something really specific. I know right now there's a lot of information happening around, vaping, and maybe that's something that you're talking about. I'd love to come and tell you a little bit about what our coalition is doing to address that and what's happening locally. I think that could also be a helpful way for them to see how it would benefit them for you to be on the radar.
Definitely. Yeah. And they really enjoy those hot topic issues as well that maybe they are not familiar with, like vaping and the devices that are used, because many of them, are older and don't have kids in school and things like that. So it's just not something I've heard them say time and time again. I had no idea. So they enjoy those presentations. And, I think that I didn't talk about it in the presentation, but it would be a great idea, even if you wanted to send that agency director, hey, it's National Mentoring Month or whatever, big topic items are coming up that month. You can send it just as an FYI, and then that local public health agency director might include that in their packet, in the Board of Health members packet, or they may, just share that information during the meeting just as general public health information. So yeah, be sure to share those significant things.
Great. Trying to, what are some other questions that folks have while we have Heather? Or if you want to share even just something that worked really well for you, that would be nice for, we've got 54 people on the webinar. So even just a tip or some advice if you've done this work that you want to offer. And Rachel wants to say thank you to Heather for presenting today.
Well, thank you for having me. I
Yeah.
appreciate it.
Let's give it just a couple more minutes to see if anyone else is kind of furiously typing or has a last minute question. Feel free to unmute or to type in the chat. Any other questions for Heather? Heather, while they're still thinking, do you want to talk a little bit about this next slide? Or did you want to have any other questions? I was looking through to see the questions we had talked about. I feel like you've covered them all. The one maybe that we didn't really drill into was about if there's anything specific to include in the presentation. But I feel like you've maybe talked about that some. Do you want to add anything else of, we've now kind of talked about if there's like a trend or if there's something timely. Do you have any other suggestions for things to include in the presentation or in your what you might be sending as part of a report?
Yeah, in addition to the things that I talked about earlier, I would just say, review that contract and do what it says in there. So like you were mentioning, I don't know the exact verbiage that you guys use, but it may be your work plan or your action plans, or your action steps, it may have some different things in there. So if you review that contract, it's probably going to have in there, the specific things that you're supposed to report back to the Board of Health. And then of course, with those things that we mentioned before, your name, what you do at the agency, what your title is, things like that. Make sure that you're just reporting about the county that you're at. It's okay to tell them, about the whole region, but really they want to know information that's specific to their county. You can tell them like how many people the program has served. And sometimes they really like to know like what schools you've been at. They always, I can see them ticking off, have all of the districts been approached, or is there somebody that's missing out? Because, it could be like if you can't get into a particular school for something, you never know that Board of Health member may have a relationship with the superintendent or the principal, and that might be your in. Because the Board of Health member maybe, might say, hey, Frank, why aren't you letting them come to your school? That type of thing. So let them know that. And then, you can give them, if it's appropriate or applicable, you can give them a financial update about the grant funds. And I know that's probably going to be specific to whatever position you hold within the community, but you can give them an update of where you're at with the grant funding as well. And I think you had the slide up that had all of the contact information for the consultants. And so any of us would be more than happy to answer additional questions that you have.
Heather, I'm wondering if we, sorry, I don't want to interrupt you. How about I do this? I'm going to see if I can go backwards really quick, and we'll send this out. But let me go back to this map right here and give everybody a minute. So if you take a peek right here, you can find your counties that you work in on this map, and then look and see who the corresponding person is for your region. If you want to grab this now, this will also get sent out. So I'll give folks just a minute to kind of find themselves on the map and see who their person is.
Yeah, and I neglected to say thanks to my colleagues, the other 5 consultants. You know, we each kind of focus on our own counties, but we do, you know, fill in for each other and help out and know a little bit about the structure of all the other counties throughout the state. So yeah, any of us would be able to hedge in the right direction.
Great. Heather, anything else that you want to share with folks?
I can't think of anything. I just really appreciate you and Katie reaching out to me, you know, and asking to talk about local boards of health. We kind of forget that sometimes people may experience some frustration with trying to get on those agendas. So hopefully we can help with that. And yeah, I just hope everybody has a great weekend, and it's another snowy-ish Friday in Iowa.
Thanks, Heather. And before folks go too far, just hang on for one more minute. I just want to, first of all, I want to thank Heather. This was really good information. I think to me, it was one of those things, even if you've been doing this for a while, there's always something that you're like, oh my gosh, I didn't actually realize that worked that way because of this, or, you know, whatever it might be. And so this was great. And I really appreciate you're bringing this to us. And also I appreciate your flexibility to do this via webinar, which I know isn't necessarily your go-to format for training. So thank you so much. I also want to remind folks that following the present, after today, you're going to get a copy of this as a PDF and a link to the recording. Anything else that something, you know, Heather thinks of something in the next few days, I can throw that in. You'll get a CEU certificate with your CEUs from Iowa Board of Certification for having participated in the training. I do only work part-time for the department, and so just please give me a couple of weeks to get that all together and get sent out to everyone. But if you need something in the meantime, feel free that my contact information is here and to reach out. And then your feedback is definitely important. I not only look at these surveys and share them back with the rest of the prevention team at the department to talk about individual like webinars and how they went, but also we things that you liked about webinars, we share those with future presenters, things that didn't work as well. And absolutely, when it's time for us to do planning for the upcoming series, I always go back to all of these surveys to see what the suggested topics were, and we use those for planning. So I pasted the link right in the chat, so you should be able to click on that as soon as we're finished here and navigate right over. It should just take a couple minutes to give your feedback, but I would really appreciate it. So thank you so much, everyone, for your participation. Thanks again, Heather. Really appreciate it.
Thank you.
I'm going to leave this open for just a sec in case anybody still wants to click on that survey link, but it looks like most folks are hopping off here. Could probably stop the recording. Let's see. Stop recording.